Hey there, amazing nurses. Today I'm diving into a critical topic, pediatric rheumatic fever and rheumatic heart disease. Let's get started. First up, rheumatic fever. It's an inflammatory disease that can develop 2 to 4 weeks after an untreated or inadequately treated strep throat or scarlet fever. Typically, it affects kids age 5-15. Rheumatic fever can hit various body parts, the heart, joints, skin, and even the central nervous system. So, what are the symptoms? Migratory polyarthritis, where large joints like knees and elbows swell painfully and move from one joint to another. Carditis, causing heart inflammation, might present as murmurs, chest pain, or even heart failure. Chorea, known for involuntary jerky movements, mainly in girls. Erythema marginatum, a pink ring-shaped rash on the trunk and limbs. And subcutaneous nodules, small painless lumps. Diagnosing rheumatic fever relies on the Jones criteria. Major criteria include carditis, polyarthritis, chorea, erythema marginatum, and subcutaneous nodules. Minor criteria are fever, arthralgia, elevated acute phase reactants like ESR or CRP, and a prolonged PR interval on an ECG. You need evidence of a prior strep infection plus either 2 major or 1 major and 2 minor criteria for a diagnosis. Now, on to rheumatic heart disease. This chronic condition stems from rheumatic fever, causing long-term heart valve damage. It's primarily the mitral valve that gets hit, leading to stenosis or regurgitation. Complications can include heart failure, atrial fibrillation, and increased risk of infective endocarditis. How does this happen? The autoimmune response in rheumatic fever inflames the heart valves, causing thickening and scarring. Over time, this leads to chronic valve dysfunction, disrupting normal blood flow and potentially leading to heart failure. Symptoms of rheumatic heart disease include shortness of breath, fatigue, palpitations, chest pain, and swelling. Diagnosis typically involves echocardiography, chest X-rays, and ECGs. When it comes to managing these conditions, early intervention is key. For acute rheumatic fever, antibiotics like penicillin are crucial. Anti-inflammatory treatments such as aspirin or corticosteroids help reduce inflammation. Supportive care and bed rest are often necessary for severe cases. For rheumatic heart disease, secondary prophylaxis with long-term antibiotics is vital to prevent recurrent strep infections. Medical management might include medications for heart failure, arrhythmias, or anticoagulation. Severe cases may require surgical valve repair or replacement. Prevention is always better than cure. Early and adequate treatment of strep throat with antibiotics can prevent rheumatic fever. For those with a history of the disease, long-term antibiotic prophylaxis can prevent recurrence and reduce the risk of rheumatic heart disease. As nurses, your role is crucial. Educating patients and families about completing antibiotic courses and recognizing symptoms of strep infections can make all the difference. Regular follow-ups for kids with a history of rheumatic fever are essential. And of course, providing emotional and psychological support is key. Remember, with proper treatment and care, many children with these conditions can lead normal lives. Thanks for tuning in and keep being the amazing healthcare heroes